Good morning, class. My name is Frederick Radford, and my presentation today is about aversion therapy. Before I start my presentation, I do want to apologize for the noises and occurrences. Currently, they are mowing the lawn at my apartment and doing some type of construction, I guess, so I do apologize. So, to begin, what is aversion therapy? Aversion therapy is basically a behavior therapy to make someone give up an undesirable habit. Some people may ask, why do we have aversion therapy or why do we use aversion therapy? We use aversion therapy to help a person give up a behavior or habit by having them associate their habit with something unpleasant. So, for example, I chew gum a lot, and every time I chew gum, my friend gives me an electric shock, for example. So, it's going to be association between a bad habit, and something unpleasant. Who usually participates in aversion therapy is, like I said, commonly is used for people who wants to break a bad habit, and also others may view this as a form of punishment for aversion therapy. So I came up with an example. In order for aversion therapy to work, I like to use the example where a friend of mine has a spending habit and she never cooks. For example, every day she gets takeout, but she complains on she never has any money, and finally realizes that she spends a lot of money. So me as the practitioner, I decided to come up with an idea, or aversion therapy, of course, where every time she tries to or begins to engage and to spend money on takeout or anything, I spray her with water from a spray bottle, because one, that's the aversive stimulus, the spray bottle, and the unwanted behavior that she wants to cease is spending all her money on food, on takeout food. And I just remind her, hey, you have food at home. So this spray bottle will remind, every time I spray her with water, she will be reminded, hey, I have food at home. I'm not spending no money on no food, outside food at least. So on the next slide, I have a YouTube video of um the TV show Friends, and it's just a form of aversion therapy, of their version of it. Of course, I'm not going to play it, but I could definitely explain it for you guys. The video basically consists of two friends. One is the practitioner, one is the patient, and the patient wants to give up the idea of the good memories of a bad breakup from her ex-boyfriend, for example. She wants to give up all the bad memories. She wants to stop thinking about the good things, and she wants to really dislike her ex-boyfriend. So her friend, which is the practitioner, she decides to show different pictures of her and the ex-boyfriend, and she tells the patient, her friend, you know, whenever I show a picture, you tell me one bad thing you notice every time I pull up a picture. So, for example, she'll pull up a picture of her and the ex-boyfriend, and the friend or patient is supposed to explain, well, I didn't like his hair that day, or something like that. So the friend, the practitioner, she begins the therapy. She pulls out a picture, and the patient, she begins describing the good memories. Oh, we went to a good restaurant that day. They had good pasta, for example, like that. And after a while, every picture the practitioner pulled up, the patient, which is the friend, she continued to reminisce on good memories. And after a while, the practitioner begins to hit her across the head, because you're not following the therapy. Instead of you trying to decrease, not well, not instead of you trying to not engage in the behavior of reminiscing on good memories, you're supposed to be reminiscing of the bad memories, because you really dislike him and it was a bad breakup. He treated you wrong. So after a while, of course, the practitioner, she just begins to slap the friend across the head, because every time she pulls a picture, she's reminded of a good memory instead of a bad memory. So, on my next slide, I will be discussing one of the psychologists of psychoanalysis, B.F. Skinner. So, B.F. Skinner's entire system was based on operant conditioning. The organism is in the process of operating on the environment. So, in this case, this special stimulus has an effect on increasing the operant. That is, in this case, the behavior occurring just before the reinforcer, that is operant conditioning. The behavior is followed by a consequence, and the nature of the consequence modifies the organism's tendency to repeat the behavior in the future. Where in our case, a behavior is followed by a consequence, and the nature of the consequence modifies the behavior tendency to not repeat the behavior in the future. So, some research I noticed, or I'm sorry, what I looked up in the past of aversion therapy was 1930s alcoholism and 1950s through 1960s sexual deviation, homosexual homosexuality. I'm sorry. So the first particular research that I have looked up was researchers. Well, to start with, alcoholism, researchers paired patients with alcohol and disulfiram medication in hopes of the patients to cease their behavior of drinking alcohol. To further explain the medication that they use, disulfiram was a drug used to support the treatment of alcohol use disorder by producing acute sensitivity to ethanol, which was drinking alcohol. I believe this medication was just used to reduce the chances of someone drinking alcohol or limit make limitations of them drinking constantly. So the second study that I have also, or research that I also came across was 1950s in Britain sexual deviation. It was somewhat of a conversion. I wouldn't say a conversion camp, but basically they brought in homosexuals, men or females, particularly men though, and they'll bring them in and basically they put them on a table and ask some questions here and there and just get a feel of what exactly activity that they were engaging in. And in order for them to cease the activity of homosexuality, they associated men messing around with other men and electroshock. So every time, I think it was every question that they answered that had something to do with homosexuality or what they engaged in, they will get electric shock. So on to the next slide. As I said before, aversion therapy is just another form of positive punishment. And positive punishment is when you add a consequence to an unwanted behavior. As my example before, when my friend wants to spend money on takeout or food, I would spray her with water, which would be the unpleasant consequence because she knows she has food at the house. So I just basically reminded her, hey, you have food at the house and you cannot engage in that behavior that you want to cease. So in order for aversion therapy to work, I do believe self-control and motivation is key components in order to make this happen. Motivation, definitely, because you have to be motivated to engage in a behavior. And you have to be motivated to engage and to not engage in behavior, which will be self-control. You have to have a strong sense of self-control not to engage in a behavior that you do not want to engage in. So on to the next slide, I would definitely say extinction has its pros and its cons. I would say for the pros, researchers will hope aversion therapy would arise extinction within the patient so they'll stop responding or stop engaging into that particular unwanted or undesirable behavior. But I would say the con of extinction would be that after a while, what if the patient begins to engage in extinction every time I spray the water on my friend when she mentions getting takeout? What if she becomes conditioned into that and her conditioned response decreases and she still continues going out buying takeout food and stuff like that? And with that extinction could be a patient could be prone to become resistant to extinction. So they could possibly develop anger, anxiety, stuff like that. So next slide, is aversion therapy effective? As I previously mentioned, one of the cons will be resistance to extinction. So when it comes to aversion therapy, is it really effective? In some cases, yes. In some cases, no. Like I said, aversion therapy can increase the anxiety that actually interferes with the treatment process. So, some patients might experience anger, hostility during therapy. Me personally, I think aversion therapy is not the most effective method to decrease behavior. I mean, it can be, but like I said, to a certain extent. I think honestly, motivation within the patient, motivation and self control are key components to decrease the unwanted behavior. One particular method that one could be used would be a commitment response. So, a commitment response is an action carried out at an early point in time that serves either to eliminate or reduce the value of upcoming temptation. So, in that case, my friend tells me, for example, I want to stop spending money on takeout food. So, would there be any way where every time I speak about take out food or anything, I will have to give you $5 each time I speak about it? And that's a commitment response, and the commitment is where every time she speaks about it, she has to give me $5 out of her pocket because that's one of her commitments, so she can reduce the behavior of spending money on takeout. So on my next slide, I do have a question for the class. Do you think aversion therapy is ethical? If so, why do you believe that? If not, of course, why? All right, thank you so much, class, for my presentation, and I hope you have a great rest of the semester. Thank you so much.